Hi, I'm Dr. Safla from Shropshire Hospital, Mumbai. I'm the patient counselor here, and I'm going to talk to you today about the third generation of laser procedures called SMILE or RELEX. So, those who want to get rid of their spectacles or their contact lenses and want to be done away with it and are thinking of a laser procedure to correct your vision, there are various options, and people do get confused because they hear different terminologies. To go into a little bit of a background, the first generation of laser procedures was many years ago, almost 30 years ago, and they worked on the actual surface of the eye, the first layer. And this layer is very sensitive. I don't have to tell you that. You know, when even a small speck of dust or an eyelash sits on this part which is called the cornea, how sensitive it is. So the first generation of laser procedures gave a lot of disadvantages, some of them being tremendous pain, difficult in healing, had scarring as well. So to overcome these disadvantages, the second generation of laser procedures was born, which is LASIK. So in LASIK, to do away with the disadvantages of the first procedure, what is done is you create a corneal flap. So you do not work on the absolute surface of the cornea, but a layer underneath. So for that, you lift the surface by creating it. This is called the corneal cap or the corneal flap. You reshape the cornea and then you replace this flap. Now again, this also had its sets of disadvantages, more with the corneal flap creation. So the complications of LASIK, 99% of them stayed with this particular step. So in trying to reduce the disadvantages of LASIK came the birth of the third generation lasers called SMILE or RELEX. So it's nothing but an acronym for refractive lenticular exchange or small incision lenticular extraction. So in this procedure, we do not do a corneal flap. So without creating the corneal flap, which means not having any cut on the surface of the eye, we are able to now treat your spectacle number or your pass. So coming to SMILE by Shropshire, it's RELEX or Vision Beyond LASIK. SMILE laser procedure is the third generation of laser correction. So the third generation is the femtosecond laser. So this entire procedure is done using just one laser. Now this technique is possible only with the VisuMax machine. The VisuMax femtosecond laser is by Carl Zeiss, and this is the equipment, and like we said earlier, it's the disadvantages of older laser treatments like LASIK have been removed and advantages of those have remained. So there are 7 reasons why RELEX SMILE is a future in laser technology. Primary being it's flapless, so it retains the biomechanical strength of the cornea. In trying to create the flap or the corneal cap, basically you're cutting almost 80% on the cornea, and this cut doesn't ever heal in theory. So in LASIK, the flap has its own set of disadvantages. In theory, it reduces the strength of the cornea. So in removing the flap, you are removing the risk of any flap displacement or flap related complications. You also are not cutting any nerves, so the corneal nerves are practically intact, and this stays that you do not have any dry eye. So when patients research online and they find one of the side effects of LASIK is dry eye, well, with SMILE you will have no dry eye. It's painless, it's very accurate and predictable, it's extremely quick, and the result is effective within 24 hours. And it's the most important thing is RELEX SMILE results are stable over many years. So when LASIK, one does hear that a small part or a spectacle correction has come back on their plate, you will not have this with RELEX. So today RELEX is the procedure of choice for all myopes. Of course, those doctors who can offer both LASIK and SMILE procedures do prefer SMILE for more than 90% of their patients. So what is the difference exactly between RELEX SMILE and LASIK? Looking at this diagram, you can see that we are talking again about the flap. So in LASIK, there is a 20 millimeter cut that is taken on the cornea, which is then lifted. So when you see in LASIK, you create that corneal flap, you lift that corneal flap, exposing the lower layer of the cornea, on which the excimer laser is then applied to reshape the corneal curvature, and then the flap is placed back. So now if you want to do away with the disadvantages of the flap and make it flapless, what is done with RELEX Smile is creating a lenticule. So a lenticule is basically equivalent to the amount of pars that has to be removed from your eye. And to remove this pars, you create it through a very small incision which is less than 4 millimeters. So when there's a 20 millimeter side cut in LASIK, there's less than 4 millimeters keyhole incision in RELEX Smile. With this, you remove this lenticule and you are preserving the biomechanical strength of the cornea. So at Shroff, the advantages to you primarily remain that we have the widest range of laser treatments. We offer wavefront LASIK, wavefront bladeless epi-LASIK, transepithelial surface ablations, topo-linked LASIK, bladeless femto-LASIK and RELEX Smile. We use two laser platforms, the Concerto 500 Hz laser and the VisuMax Zeiss laser. Do remember that your entire procedure output depends on the input, and that's why Dr. Anand Shroff, our LASIK or Smile surgeon, looks into the tests which are specific for LASIK himself. He personally examines you to see that out of these entire list of laser procedures, which one is more applicable for you or which one is the most safest for you, and only the best laser treatment for your eyes from these is advised to you. So Shroff was one of the first hospitals in India to be accredited by the Joint Commission International from USA. We have two centers, one in Bandra and one in Marine Drive, and having over 95 years of excellence in eye care, we are capable of helping you and looking after your eyes with the best in mind. So do write to us at info@shroffeye.org. You can even go on our website www.relex.com. You can visit shroffeye.org for other eye care queries, and you can call me on 98211 63901 to answer any further queries. So I'm Dr. Safala, and I look forward to hearing from you. Should you have any questions, please do not hesitate to call us. Thank you.